Start off with something I'd mentioned to you earlier on. It's a COVID-19 spike where medics believe that we might be facing a third wave. There's even more spike right now happening. But there's a new strain that has these symptoms that I'm talking about, and it's not all. Aches and pains in the chest, discoloration of toes and fingers, skin rashes, vomiting and diarrhea. These are not the typical symptoms of COVID-19, but the new strain. This is why tonight we're beginning with the news of a spike in the COVID-19 infections in the country. So medical practitioners in the recent weeks raised concern over what appears to be a third wave of COVID-19 in the country, following a gradual increase in the number of infections recorded. But while that seems to be the case, patients are now presenting themselves with new COVID-19 symptoms away from the usual fever and dry cough. And as Raquel Muigai now reports, hospitals are on high alert over the new variant.
The once perplexing array of COVID-19 symptoms like coughing, fever, loss of smell and taste senses are now very familiar with doctors around the country. But over the last few months, medical practitioners have raised concern over the symptoms presenting in COVID-19 patients, not just globally, but also here in Kenya. This poster by Nairobi West Hospital meant to serve as a reminder to the hospital staff about other prominent symptoms present in COVID-19 patients, among them chest aches and pains, diarrhea, discoloration of fingers and toes, skin rash and conjunctivitis.
The majority of the patients are coming with difficulties in breathing. They may even tell you, I don't have any fever or I don't feel feverish. And actually, by the time they are admitted, quite a majority of them will be requiring intensive care.
Other hospitals like the Kenyatta National Referral Hospital also recording patients coming in with the not-so-classic COVID-19 symptoms.
Some rare symptoms that we see, for example, some people will have diarrhea, some will come with vomiting, some will present with headache. Occasionally we see a rash, so a few people have reported some rash. The question about discoloration is an interesting one. We haven't seen it too commonly, and the reason why that happens again is not well understood. We know that COVID on its own may cause a lot of clotting in the small blood vessels, and if that happens, for example, in the hands or in the toes, then you may see a bit of discoloration.
While researchers have a better grasp of the disease now, there is still much to learn as the virus continues spreading and mutating, presenting itself in unexpected ways. Here in Kenya, the upsurge in the number of infections in the recent weeks is a source of concern.
By mid-February, our wards were literally empty. In fact, by mid-February, we had only 2 patients who were critical in our ICU. However, by the end of February, we started noticing that the numbers are going up. Yes? And as we talk now, we have a total of 38 patients who have been admitted in the last 2 to 3 weeks.
Dr. Andrew Gachie tells us that in the last 24 hours, the Nairobi West Hospital has admitted 10 COVID-19 patients, out of which 6 are critically ill, a majority of them being between 30 to 45 years of age.
So could we be dealing with a new virus? Could we be dealing with scientifically what we call a new mutant of the virus? These are the questions we need our scientists to be able to tell us. We need still to be very cautious about this virus. We are not yet out of the woods.
Even in country, we've had a few variants. It's only that they are not of concern. Whether specific variants lead to a different set of symptoms, I'm not very sure about that. I think that's an area that will be of significant interest as time goes on and an area of study.
A January 2021 survey from the United Kingdom, created by the University of Oxford, University of Manchester, Public Health England and Wellcome Trust, discovered that there are some slight differences in symptoms for those who had the UK COVID-19 variant compared to the normal mutation. So far, 109,164 people have been infected with COVID-19 in the country after 337 people tested positive in the last 24 hours. Additionally, 532 have been admitted across various hospitals in the country, 74 among them being in intensive care units. However, the COVID-19 vaccination drive has already kicked off in counties like Kiambu, Taita Taveta, Machakos and Nandi. Raquel Muigai, Citizen.